Welcome to Season 3 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Josh Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former Secretary of Maryland's Health Department. Our goal is to bring scientific evidence and experience to the public health news of the day through informative interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Today, Stephanie Desmond talks to Kathleen Page, an infectious diseases doctor at Johns Hopkins, who works with the Latino community in Baltimore, where many are young, undocumented immigrants. They discuss how COVID-19 has ravaged that community and how important it will be to make sure the population is vaccinated. Let's listen.
Kathleen Page, thanks so much for joining me.
Thank you so much for having me. My pleasure.
I'd like to talk to you today about the Latino community. I understand you're an expert in the community, and I wanted to talk about COVID and how I understand that they're being disproportionately impacted. Many are more dying. The positivity rates are double and triple the rest of the population. Can you talk to me about the situation and really why this is the case?
Yeah, thank you for that question. And as you mentioned, I have been working a lot with Latinos and in particular low-income Latino immigrants. And that's a group that I think has been particularly heavily hit. And as you mentioned, we've seen not only higher rates, but also higher hospitalizations and mortality, particularly among a younger population, because Latino immigrants generally are younger than the general U.S. population. So let's start with why this high risk of transmission. And what we saw early on in the pandemic was that as things shut down, many of these low-income immigrants continue to go to work. And the reason they continue to go to work was multifold. But one is that they were often employed in essential work that was allowed to work, so construction, manufacturing, food processing, et cetera. Secondly, and very importantly, many of these immigrants don't have documentation, which means that they weren't going to get unemployment benefits. They weren't going to get the stimulus check. And because of the work that they do, which is generally low wage, the financial reserve to be able to stay home and not work was really quite limited, especially for those that were, many of them, not only supporting families here, but also families abroad. And so early on in the pandemic is really quite notable. For example, in our hospital system, but throughout the country, the number of immigrants that were infected with COVID at work. And what people, and at that time, we probably didn't know exactly what the occupational protections had to be, but also remember these low income, again, undocumented, especially those who are undocumented immigrants, they don't have a lot of political power to be able to complain or ask for protections. And so that, I think, drove a lot of the transmission. The second piece, which is associated with, I'll say it's associated with poverty, is that many of these low-income immigrants, to save money, share rent and share spaces. And so the housing conditions tend to be really, really crowded. And it was really quite notable to meet people who said, everyone in my household is infected. And when you asked a little bit more, you found out that there's a house with 4 rooms, and in each room there was one family, and they were all sharing one bathroom. Or another common situation is that co-workers that may or may not be related or friends, but they work together in a certain place, they share a basement, and as a way to save rent. And lastly, especially for people for many of these low-income immigrants, depending on where they work, if they don't have transportation, they're either taking public transportation, but it's not uncommon to also be picked up by vans that take them to a work location. And sometimes those rides can be crowded and can be over an hour long. And so you can imagine that in that scenario, how easy transmission would happen.
It's interesting because I think we think of, we tell people what to do, we tell them what's best for their health, and they will abide. Now, we've seen that that's not necessarily the case generally with COVID, but I think very specifically with this community, it's really impossible.
Yeah, and I think, it was actually pretty heartbreaking going around the wards and meeting people who told me they really were trying to do the right thing. And some of the stories, and again, part of it was we didn't know the right information really from a public health standpoint. The importance of masks, for example, were probably not emphasized enough early on. And there was a lot of emphasis on hand washing and surfaces. And so I heard people say, I don't understand how I got this because I change my clothes 5 times a day and I leave my shoes outside the house. But they were not wearing masks at work and they were in crowded spaces. The other thing is, as you mentioned, some people, even if they stayed home. So what I found more commonly for women to stay home, not always, but sometimes the women would stay home with their kids and family while others went out to work. And so they were like, I stayed home. My whole family stayed home, but there was someone in the household who went out on work. And then when you come back again to a very crowded space, even those who stayed and did everything as they were told, there's just no way of preventing transmission in that scenario.
Mm-hmm. And even as you mentioned, the government benefits that are out there to help people, immigrants aren't eligible for the most part. The undocumented immigrants are not eligible.
Yeah, I mean, I think the issue with unemployment benefits have really been a lifesaver for many people. I mean, you can imagine that with what happened, if people didn't have unemployment benefits, you can't survive. But many immigrants really were not eligible for that. And then the stimulus check went even beyond that, because if you read carefully the stimulus check, not only if you were an undocumented immigrant, but if you were not an undocumented immigrant, someone who was eligible, for example, even a U.S. citizen, but you filed taxes with someone who was not eligible, no one got that stimulus check. So there was really, most people did not get that, and they just, you have to survive. And I'm telling you, I am not exaggerating when I tell you that I met more than one person, several people who came out of the ICU off the vent, and the first question they had for me was, "When can I go back to work?" Or "How am I going to pay for this hospitalization?" So finances are first and foremost, and I think drove a lot of the behavior that people had, and as a necessity, truly.
Yeah. You have written about how the system isn't really set up to care for undocumented immigrants. And in fact, it's designed to make them afraid.
Yeah. I mean, I unfortunately, the immigration policy over the last few years has relied heavily on fear. There have always been, even prior to this administration, there had been immigration raids and people would get deported, but it was much more clear who was at risk and who wasn't. And in the last 4 years, that changed. And I think that just created a ton of fear. So the things that specifically I'm talking about was the unpredictability. So before, people who did not have a significant criminal record could be confident that they were not in the priority list for deportation. Mm-hmm. But that really changed in the last few years. These sort of episodic raids and you don't need to have a lot of stories of people being picked up, like happened here in Baltimore one time, a father picking up his child from school and then being picked up by ICE. You don't need a lot of those stories to get people really afraid. And then on top of it, there's been some policies, including the public charge rule, which was put into law right before COVID started, ironically, but although it had been sort of circulating through the courts for quite some time. And that rule basically stated that people who use certain types of benefits may not be eligible for a green card and then citizenship. And again, there's so much confusion about that. Like, the reality is that that rule really applies only for those people who have a pathway towards regularization of status, which is not the case for many, many, many undocumented immigrants. But it is the dream of all undocumented immigrants to get status. And it also doesn't apply for every benefit. And in fact, as soon as COVID started, there was an announcement made in the site saying, you can still seek COVID care and that won't affect your immigration status, or it doesn't apply as a public charge. But how many people are reading this, and I think people just didn't know. And so in that context, not only was it, I think the perfect storm and the perfect unfortunate storm was not only was the conditions were there for a lot of transmission, as we spoke before, but there was also conditions set so that people didn't seek help when they needed it. This is a group that has survived by living in the shadows, and it's hard to come out of the shadows when a crisis like this happens. And so it was, we heard a lot about people who had been sick for quite some time and delayed seeking help because they were afraid, they didn't know where to go, and that of course not only led to more transmission wherever in the household, and also in some cases had really bad medical consequences. So it's not good to sit at home hypoxic for too long. That's generally not conducive to good health and recovery.
And if there are communities in which COVID is allowed to sort of spread willy-nilly, we're never going to get control of the overall epidemic.
Yeah, I think that's really important. I mean, it gets to a point, and I think we saw that here, where the transmission was so high that just the usual strategies that we have in public health of contact tracing and isolating became almost unmanageable because there were just too many people to handle, and also because isolate by the time we got to people, as I mentioned before, so many people in their household or workplace had already been infected. And, just to give you a sense, we've been doing community testing here in Baltimore, and the positivity rate among Latino immigrants has consistently been over 30% throughout this period, generally, even when it was less than 5% in the general population in Maryland. So it's really been simmering along, and there's never been real control of that. And of course, it then, there's crossover, right? Because these immigrants and essential workers are working in places that we are all in. They're working as housekeepers, as nannies, and so there's it's not a good public health strategy to exclude and ignore one group of people and think it's all going to be fine.
Right. And looking forward to the vaccine, do you foresee problems getting this population in for their shots?
Yes, unfortunately, yes. And I think it comes in different flavors. So one is, we talked a little bit about fear and mistrust that comes along with things that have happened. And I think there's a lot of, I wouldn't say this is, of course, we hear about this in many different groups, but there is a level of mistrust in government and in governmental entities. And so I think there seems to be, at least from what I hear from my patients and conversations I'm having with community members, more mistrust than you would like and expect in other times about the vaccine itself. Is it safe? There's from the range of very extreme conspiracy theories, this vaccine was designed to, but that's one extreme. But even in those who don't feel as strongly, this just skepticism, is this truly safe? Can we trust something that was made under an administration that has been against us, et cetera? Mm-hmm. So that's one piece. The other piece, I think, is just going to be general distribution. And we're going to run into the same issues that we ran when the pandemic started. And, when the pandemic started, there was these recommendations to call your doctor, stay home, and a language. So making sure that all the information is given in the right language, but also, if with the distribution happens through your primary care doctor or happens through venues where people think or need, or even if they perceive that you need to have health insurance, then people are not going to have access. Because many undocumented immigrants don't have a primary care doctor. Many are uninsured, most of them. And And again, unless it's very clearly stated, this is available whether you have insurance or not. It's going to be at no cost. It doesn't matter if you have papers or not. If those messages are not said clearly, people will assume it's not for them because they've been excluded all along. So they've been excluded from healthcare all along. So there's no reason why we should assume that people will assume that if they don't have health insurance, if they don't have papers, this is going to be available to them. Right. And so I'm hoping, I'm sure there's some very smart and good public health people thinking about these things. But I do think the trust issue and sort of thinking about the distribution and who can get to these communities. So, we've, even in our testing work, we've engaged very heavily with trusted community leaders, having them be not only messengers and influencers, but also bringing people together. The testing that we do literally is in the back of a church, even in the cold, because that's the place that people come to. And so I think the same will have to happen with a vaccine. If for some reason, because this is a big endeavor, it becomes, as an example, very militarized and it's only I think that's really going to dampen uptake in this community.
And I guess the fact that you have to come back in 3 or 4 weeks, they've taken your information down, which you don't really want to give in the first place. And you have to come back. I mean, I can see how that would really garner mistrust.
Yeah, I think that's such an important point. And of course, again, I'll speak from my own experience in the community testing that we're doing. We have to take people's information because these are not rapid tests. We have to call them back the next day and give them the results. And in general, but we're very careful about what we ask. So we only ask name, date of birth, and their a phone number. Just so that we can create a chart and get people and contact people. And we tell them we're going to contact them. And, everyone who's doing this work is bilingual and actually mostly bicultural. So that I think has built trust in the system. But, what we don't do is ask people for Social Security. We don't even ask for insurance because we fear that if by asking that, people may assume that you need that. And so what information is asked for that 1 month follow-up, I think is going to be important to really think through, especially if the information is being asked by what's a governmental agency or what's perceived to be a governmental agency. Because although we know that there's HIPAA protections and protections against sharing that information with immigration authorities and others, again, these are the things that we shouldn't assume people know. We shouldn't assume that people trust or know that would not happen.
Kathleen Page, thank you so much for talking with me.
You're very welcome. Thank you for having me.
Public Health on Call is produced by Josh Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Spencer Greer, Niall Owen McCusker, C.N. Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo and Neiman Outland. Social media support from Brenda Haggader, Grace Holes Fernandez, and Caroline Wong. Thank you for listening.